Hello my friends, Dr. Mandell here. Today I'm going to share something every senior must know because it can save your life or the life of someone you love. Strokes strike every 40 seconds, and most happen suddenly, without warning, without mercy, and often when you're all alone. But here's the good news. There is a simple 3-minute emergency technique backed by science on blood flow, oxygen circulation, and brain protection that can slow down stroke progression until medical help arrives. This is not a cure. This is not a replacement for a doctor. This is a first aid technique that supports your brain during those critical first minutes. Every year, more than 15 million people worldwide suffer a stroke, and nearly half of them never return to the life they once knew. But what most people don't realize is that the difference between survival and catastrophe often comes down to 3 minutes. 3 minutes in which your brain is silently begging for oxygen. 3 minutes where the wrong move can accelerate the damage, and the right action can slow it down just long enough for help to arrive. When a stroke begins, millions of brain cells start dying every single minute. Research from the National Institute of Neurological Disorders and Stroke shows that the average stroke destroys 1.9 million neurons per minute, meaning that every passing second is equivalent to losing weeks' worth of neural connections. That's why the human body doesn't give you time to panic. It gives you seconds to act. And the first action is deceptively simple: sit down immediately. This is not weakness. This is strategy. When you sit, you stabilize blood pressure swings that can worsen the stroke. You prevent the heart from struggling against gravity. You protect yourself from falling, which can cause additional trauma, bleeding, or spinal injury. It sounds small, but in those first 30 seconds, sitting down saves both energy and oxygen, two things your brain is losing rapidly. But the real power begins when you take your first deep breath. Not a shallow gasp, not a panicked inhale, a slow, controlled, diaphragmatic breath that forces your lungs to expand and floods your bloodstream with precious oxygen. Scientists at Harvard Medical School found that deep breathing increases oxygen saturation levels by up to 20%, enough to temporarily support brain cells that are suffocating during the early onset of a stroke. And what's shocking is how few people know that the breath you take in those first moments can literally buy your brain more time. As you inhale through the nose, hold, and slowly exhale through the mouth, something remarkable happens. Your vagus nerve, the body's emergency brake, activates. Heart rate slows, blood pressure drops, circulation stabilizes, and instead of your body spiraling into chaos, it begins fighting back. 60 seconds of deep breathing isn't meditation. It's brain defense. It's metabolic protection. It's one of the few tools you carry with you everywhere you go, ready to use when your body sounds the alarm. After that first minute, there's another unexpected step, one that seems too simple to matter, yet plays a powerful role in how blood flows to your brain: relaxing the jaw. Most people clench their jaw during panic. This creates tension along the neck and decreases circulation through the carotid arteries, the main highways delivering blood to the brain. Neurological studies show that jaw tension can reduce carotid flow by as much as 15%, enough to accelerate brain cell death during a stroke. But when you loosen the jaw, release the pressure, and allow the muscles to soften, those pathways open just slightly, just enough to improve the flow on the side of the brain that's still functioning. For 30 seconds, the body adjusts. The neck relaxes. The arteries expand. The brain receives a little more oxygen, a little more blood, a little more time. And in this situation, time is life. Then comes the gentle stimulation of the carotid area, the sides of your neck where the body monitors blood pressure and flow. Not pressure, not rubbing, just a soft sweeping motion, downward, almost like brushing away dust. This is important. It must never be done aggressively. But research from cardiovascular physiology shows that light sensory stimulation can increase blood vessel responsiveness and support flow on the unaffected side of the brain. It's not a cure. It's not treatment. But it helps sustain circulation while paramedics race toward you. Simple touch, performed gently and safely, becomes another tool in your 3-minute window of survival. But there's still one more step, one that is rarely discussed, yet may be the most powerful of all: staying awake and mentally active. Most people want to close their eyes during a stroke. Fatigue hits fast. Confusion builds. Speech becomes difficult. But neurological studies show that remaining conscious, alert, and engaged keeps neural circuits firing, slows down brain shutdown, and encourages the brain to reroute communication around damaged areas. Talking, even if the words come out slurred, activates multiple brain regions simultaneously. The frontal lobe, the temporal lobe, the auditory cortex, the motor cortex. When you keep talking, you keep pathways alive. And if you're alone, you talk to yourself. You repeat your name. You describe what you're feeling. You count numbers. You force your brain to stay active, no matter how hard it feels. If someone is with you, They become your lifeline, speaking calmly and consistently, helping your consciousness fight against the fading signals. Every sentence is brain preservation. Every word is a spark that keeps neurons firing for just a little longer. By the time you reach the end of these 3 minutes, sitting, breathing, relaxing, stimulating, talking, you've done something extraordinary. You've slowed down a process that usually moves with merciless speed. You've protected brain cells that would have died. You've stabilized your body long enough for help to arrive. And even though this technique cannot stop a stroke, cannot replace medication, cannot cure the underlying issue, it can delay the devastation. In medical emergencies, delay is power. Delay is survival. Delay is the difference between walking again and never standing, speaking again and remaining silent, recognizing your family's faces and losing them forever. What you do in those first 3 minutes determines the next 3 decades of your life. And the greatest tragedy is how many people reach the hospital too late, not because help didn't come, but because they didn't know what to do until help arrived. Now you do. And now you can share this knowledge with someone else. Because one day, your voice, your calmness, your 3-minute technique may be the reason someone lives. And that is the true power of understanding what the human body can do when you give it a fighting chance. Every second counts when a stroke begins. Strokes don't send invitations. They don't give warnings. One moment, life is normal. The next, everything changes. The terrifying part is that most people don't even know what to look for until it's too late. According to the American Stroke Association, nearly 80% of strokes are preventable, yet thousands die each day simply because the warning signs were ignored or misunderstood. And yet, it's not complicated. If you can recognize the signals, you can act immediately, you can save a life, you can preserve brain function. The first sign is sudden numbness or weakness, usually on one side of the body. Your arm, your leg, your face suddenly feel heavy, unresponsive, or completely detached. This is your brain screaming for oxygen. The motor cortex responsible for movement is shutting down, and your body is betraying you because blood is no longer reaching the neurons it depends on. Studies show that one-sided weakness is present in nearly 90% of stroke cases, yet so many ignore it as fatigue or old age. This is an alarm. Another sign is slurred or garbled speech. 1 minute, you're talking normally. The next words twist and refuse to come. Speech requires the synchronized effort of dozens of brain areas, and even a slight blockage can cause failure. Research from Johns Hopkins shows that people who recognize slurred speech as a warning sign and call emergency services immediately have a 50% higher chance of survival without lasting disability. If your mouth suddenly struggles to form words, or if someone asks you to repeat a sentence and you can't, your brain is in distress. Time to act. Vision changes are equally shocking. Blurry vision, double vision, or sudden loss of sight in one eye is more than inconvenient. It's a signal that the visual cortex is losing oxygen. One study in the Lancet Neurology found that up to 30% of strokes begin with vision disturbances, and these patients often delay treatment, thinking the problem will pass. It won't. Dizziness, loss of balance, or sudden unsteadiness is another subtle but deadly warning. Your cerebellum, responsible for coordination and balance, is starved of oxygen. According to the National Institute of Neurological Disorders and Stroke, strokes that affect balance are particularly dangerous because they increase the risk of falls, which can worsen the injury and even lead to head trauma. And then there's the sudden, intense headache. An excruciating, unlike anything you've ever felt kind of pain. Studies in neurology journals report that a sudden, severe headache can precede hemorrhagic strokes, a type of stroke where blood vessels rupture inside the brain. Ignoring it can be fatal. But here's the shocking truth: many people experience multiple warning signs at once yet dismiss them. They feel weakness and slurred speech and dizziness and think it's exhaustion, dehydration, or just a momentary glitch. Meanwhile, their brain cells are dying by the millions every minute. The science is brutal. A single minute without oxygen kills nearly 2 million neurons, and in 10 minutes, you can lose the equivalent of 20 years' worth of memory storage. Recognizing these signs is not optional. It is literally the difference between a life lived fully and a life of permanent disability or death. There's a simple mnemonic that doctors use: FEST. F for face drooping, A for arm weakness, S for speech difficulty, T for time to call emergency services immediately. If any of these appear, the clock starts ticking. Every second matters. But here's what most people don't know: recognition is not just about seeing symptoms in yourself. Often someone else notices them first. Research shows that strokes are more often survived when a bystander acts immediately than when the patient delays. That's why education is crucial. Families, caregivers, and even friends must know the signs. Your awareness could save a loved one's life in the time it takes to dial 911. Imagine the scenario: an elderly parent sits quietly, suddenly drops a cup, struggles to form a word, their face slack on one side. If you hesitate, thinking it might pass, the neurons keep dying. But if you act instantly, call for help, follow emergency guidance, you give their brain a fighting chance. Recognizing stroke symptoms fast also allows for immediate pre-hospital interventions. Paramedics can administer oxygen, monitor blood pressure, and rush the patient to the stroke unit where clot-busting medications like TPA can be administered within the critical window. These treatments are only effective if the stroke is identified early. Every delay diminishes effectiveness exponentially. And it's not just physical signs. Subtle cognitive changes can appear first. Confusion, trouble understanding simple instructions, or sudden inability to perform familiar tasks. Science shows that these cognitive indicators are often the brain's earliest cry for help. If ignored, they can escalate into full neurological collapse. The tragic reality is that many seniors who are at the highest risk live alone. They may not have anyone to observe these subtle changes. That's why awareness is not optional, it is survival. Everyone must internalize the signs so deeply that recognition becomes instinct. Sudden weakness, slurred speech, dizziness, blurred vision, severe headache, confusion. These are not random events. They are the body's most urgent signals, the red flags waving in a storm that is racing through your brain. And while medical technology is advancing, while stroke units are sophisticated, and while emergency response has improved dramatically, nothing replaces human recognition at the first instant. Because it is recognition that triggers action. Action that can preserve life, protect independence, and prevent irreversible damage. The most shocking studies tell us that delays of just 30 minutes can turn recoverable strokes into lifelong disabilities. 30 minutes is the difference between walking again and needing lifelong care, between speaking clearly and struggling to form words, between seeing your grandchildren and watching life through blurred eyes. And yet, the cure is awareness, plain and simple. Learn the warning signs. Internalize them, rehearse them mentally, share them with your family, practice FAST. When that moment comes, there is no time to think. There is only time to act, and that action can be the difference between survival and tragedy. Recognizing stroke signs fast is not just knowledge, it is power. It is the most important skill a senior, a caregiver, or any human being can possess. Because in the seconds a stroke begins, your brain is losing its battle, and the only chance it has is for someone, yourself or a loved one, to see the signals, understand them, and move with decisive urgency. Every stroke is a race against time. Recognition is the starting gun. Awareness is the engine. And action is the only path to survival. Prevention is where true power lies. While strokes can strike suddenly, science proves that the choices you make every single day build a shield around your brain and arteries. It's not luck, it's biology, nutrition, and habit. One of the most shocking facts is that nearly 80% of strokes are preventable, yet millions continue to suffer because they underestimate the influence of daily foods. The first food that can transform your risk is garlic. Not the garlic in a powder packet. Not the faint hint on a pizza. I mean raw or lightly crushed garlic, rich in allicin, the compound that acts like a natural blood thinner. Allicin has been shown in multiple studies to reduce platelet aggregation, preventing dangerous clots that can starve the brain. In elderly populations, just 1-2 cloves of garlic daily can lower blood pressure significantly and improve arterial flexibility, giving your brain a fighting chance against sudden blockage. Next is turmeric, the golden spice revered for centuries. Now backed by science, the active compound curcumin is a potent anti-inflammatory that penetrates the bloodstream, reduces arterial plaque, and protects endothelial cells, the walls of your blood vessels, from oxidative damage. Research shows that curcumin can reduce the risk of atherosclerosis, one of the leading causes of ischemic stroke, by lowering inflammation markers like CRP and TNF-alpha. But turmeric alone is not enough. It requires piperine, found in black pepper, to enhance absorption. Just a pinch in warm water or added to meals ensures your body uses it fully. Then there are walnuts, small but extraordinary powerhouses. Rich in omega-3 fatty acids, they improve cholesterol profiles, reduce LDL oxidation, and strengthen vascular walls. Studies from the Journal of Nutrition show that daily walnut consumption can lower arterial stiffness by up to 25% in seniors, directly reducing the pressure your heart and brain face with every beat. These are not magic numbers. They are real, measurable reductions in stroke risk. Citrus fruits and kiwi are another revelation. Their vitamin C and flavonoid content don't just fight scurvy, they improve blood viscosity, enhance capillary integrity, and reduce platelet stickiness. Observational studies show that adults who consume citrus daily have a 40% lower risk of stroke, a staggering figure that emphasizes how nature's foods outperform pills when used consistently. Then comes beetroot, a humble vegetable whose nitrate content converts to nitric oxide in the body, dilating blood vessels and lowering blood pressure naturally. Clinical trials reveal that beetroot juice can reduce systolic blood pressure by up to 10 mmHg, a massive change for seniors at risk, and improve cerebral blood flow, literally nourishing the brain and protecting neurons from the early stages of oxygen deprivation. Yet food alone cannot shield you completely. Lifestyle habits are the invisible framework supporting your arteries and brain. Walking just 20 to 30 minutes daily improves circulation, maintains healthy blood pressure, and even enhances neurogenesis, the creation of new neurons in the hippocampus, the very area critical for memory and cognition. Hydration, often overlooked, is a silent protector. Thick, viscous blood flows slower, increasing clot risk. Drinking water consistently keeps your blood thin, your vessels lubricated, and your brain fed. Stress, the invisible killer, plays a sinister role. Cortisol spikes constrict blood vessels, raise blood pressure, and accelerate arterial inflammation. Deep breathing, meditation, or even simple relaxation techniques lower cortisol levels and reduce stroke risk. Sleep, often underestimated, is another battlefield. During deep sleep, the body flushes toxins, regulates blood pressure, and repairs arterial walls. Seniors who sleep 78 hours consistently have significantly lower rates of stroke and heart attack than those who cut sleep short. Medication adherence is equally critical. High blood pressure, diabetes, and high cholesterol are silent assassins. Skipping doses or ignoring prescriptions is like leaving a door unlocked for disaster. When these habits and foods converge, they create a powerful synergy. Garlic thins, turmeric calms, walnuts strengthen, citrus and kiwi protect, beets dilate, exercise energizes, hydration sustains, sleep repairs, and mindfulness shields. The brain becomes resilient, arteries become supple, blood flows like it was designed to flow. And the most shocking truth is how quickly changes can take effect. Studies show that incorporating these foods for just 3 months significantly reduces blood pressure, inflammation, and clotting risk. That is not a lifetime, that is 90 days to drastically alter your future. It's not a coincidence that populations who consume these foods regularly, Mediterranean diets, Indian diets rich in turmeric, and plant-based diets with nuts and fruits, have some of the lowest stroke rates in the world. Science has mapped this. Clinical studies, longitudinal trials, epidemiological surveys, they all point to the same conclusion. What you eat daily, how you move, how you rest, and how you manage stress determines your brain's fate. And while genetics play a role, lifestyle often trumps heredity. This is liberating because it means you have control. You are not at the mercy of chance. You can choose the foods, the habits, the actions that safeguard your mind and body. And the earlier you start, the more powerful the protection. Every meal, every walk, every night of proper sleep is a brick in the wall against stroke. And when combined with recognition of warning signs and the 3-minute emergency techniques, your resilience is exponentially increased. It is not exaggeration to say that these simple, natural interventions, foods, water, movement, sleep, mindfulness, could save your life when seconds matter most. And it is equally important to spread this knowledge. Seniors, caregivers, families, friends, everyone should know that nature provides tools far beyond what medicine alone can offer. When you integrate these foods and habits into your life, you are not just eating or exercising. You are arming your brain and body against one of the most terrifying events you could face. Prevention is power. Awareness is power. Action is power. And when combined, they form a shield stronger than fear, stronger than chance, stronger than fate itself. You can control the odds. You can nourish your brain, strengthen your arteries, and lower your risk of stroke dramatically. The choice is yours. Every meal, every sip of water, every walk, every night of sleep, every moment of calm builds resilience. Every time you act consciously, you tilt the scale in your favor. And the most shocking fact, it doesn't require magic, money, or extreme effort. Just knowledge. Just commitment. Just action. Nature has given you the tools. Science has shown they work. And the only missing piece is your decision to use them, starting today.